Hello and thank you for joining us on DITV World News. I am Ahmed Hassan Ahmed with the news in details. About 20 children have been confirmed to have measles following a reported measles outbreak in Unguwan kanawa village of Dusan Abba in Zaria local government area of Kaduna State. The discovery was made by a team of United Nations Children Education Fund UNICEF personnel who visited the area to conduct a routine polio immunization exercise as part of events marking the African Vaccination Week 2025. Big catch-up under the theme, Immunization for All is Humanly Possible. Correspondent was there and now reports. Unguwan kanawa in Tankaro Dusan Abba Ward is located in Zaria local government area, and it is a remote village without electricity and hospitals. According to the villagers, they usually trek 7 kilometers to access medical facilities. The visit by the UNICEF team, led by Dr. Greda Burikila, who is also the chief of UNICEF field office in Kaduna, in collaboration with the Kaduna State Primary Healthcare Development Agency, discovered the outbreak. Speaking to newsmen while administering vaccines to the children, Dr. Greda Burikila and Dr. Sulemeli explained that the community had 100% non-compliance to vaccination in the last 3 years, and according to them, this accounted for the outbreak. She, however, said with the intervention of the government, religious and traditional leaders, as well as development partners, they are gradually accepting immunization.
This community, I'm told 3 years ago, there was 100% refusal for vaccination. And as you have observed for yourself, there is a serious measles outbreak. Several children have never been immunized, and as a result, they are suffering from measles. In one family of 9, they have already lost 2 children, and others are still sick. So it is very important for the community to immunize their children. And under this backdrop of the vaccine shortage, as you can see, we try to find a vaccine for measles. That is shortage in the country. And it's really important that we secure predictable vaccination and vaccines for the children.
Also speaking in an interview, Hamza Ibrahim Ikara, the Director of Public Health at the Kaduna State Primary Healthcare Development Agency, said the refusal and non-compliance to immunization by the community is a serious setback, the major outbreak, and that explains the recent outbreak. He said the surveillance officer of the local government has been directed to intensify surveillance, while sensitization with household heads and vaccination will continue in order to stop the outbreak.
On this process, we have to intensify the issue of routine immunization, which is one of the cardinal ways of reducing maternal and infant mortality rate across the country. So, if as what you have been seeing in the community now, we have identified a lot of children that has fallen the issue victims of measles cases because they have never received immunization of measles that we have conducted some few months back, and also they are not going out for routine immunization. Even our outreach team that have been visiting them, they are not bringing their children for this type of immunization. So this is the end of the issue related to refusal or the issue of non-compliance related to immunization. So this is what happened in this community, but we have been doing our possible way to ensure that we have great awareness within the community members, because they have even highlighted why they are not taking their children for immunization.
Also speaking in an interview with newsmen, the village head of Unguwan kanawa, Tankaro, Nasiru Yunusa, who spoke in Hausa language, commended the team for the intervention, noting that so far 4 children have lost their lives because of non-compliance by their parents. He advised parents to take their children for immunization.
Wannan tsakanin yara sun samu sun kawo da ciwon kyanda. Wannan ciwo shine ya zama cewa ciwon yayi serious dan har ya kashe mana yara kusan guda 4.
He however called on the state government to provide electricity and medical facilities to the community. Also speaking in an interview, some of the women blamed their husband for refusing to immunize their children. Saadat Sofianu lost 4 of her children, while another woman, Rahma Salisu, a nursing mother with an 8-month-old measles-stricken child, said she had never visited the hospitals or vaccinated her child.
Mai gidan ya hana, sai na roƙe shi wata rana na ce ya taimaka ya bari in mata. Ya ce a'a ba zai bari ba, na ce ya taimaka yana dai ganin ƴaƴan inda suke.
The African Immunization Week, which commences from 24th April to 30th April, is expected to help sensitize and address some of the challenges of non-compliance. I am Hassan Ahmed reporting for DITV World News. In a bid to shed its zero-dose status of unimmunized under 5 children, the Bauchi State government on Friday flagged off its polio immunization campaign